Hey, Purple Scarlet Topaz here. Just so you know, I'm still here. I've been, going through. I've been going through, and my third eye was going through a process, cleansing and healing and all of that good stuff. And my new year is basically starting now. Okay, so anyway, I have an issue that I want to discuss with everyone, and I hope you pay close attention, especially Black women, women of color. Okay, I want to talk about the issue where it comes to the statistics and the data regarding the high mortality rate of Black women during childbirth. Okay, we know that that's a problem, and now they have people, I guess they're trying to correct it, see what's going on or whatever. But I want you to be aware that from my understanding and my common sense reasoning and all of that, when they say that that is a problem, that there is a high mortality rate among Black women during childbirth, I see that as a symptom. Okay, it is a symptom of a broader issue dealing with Black women and women of color. Okay, that is just the symptom, and so we need to be aware of that. And it's sort of like a symptom when we look at that. Like, let's say a person has an infection, a disease, a virus. Okay, it shows up their symptoms that come along with those things. If a person has a cold, then the symptoms of their cold may be a runny nose, sneezing, okay, or if it's the flu, it'll the symptoms will be fever, nausea, throwing up, achy muscles, all stuff like that. So I see the high mortality rate in Black women during childbirth as a symptom of something bigger. And the thing is that it's simply manifesting itself in that area. It's manifesting itself in the area when it comes to Black women, the high mortality rate during childbirth. Okay, and I'm going to share with you why I've come to that conclusion. Okay, just based on my own experience from what I've seen. Okay, I had an aunt. She's passed away, but she lived to be 100. She almost made it to 101. But before she passed away, a while, she lived, but anyway, okay. This is what happened. Okay, and this is why I can say what I'm saying now. My dear old Aunt Hattie, my grandmother's sister, she was sick in the hospital. I don't know if she had her blood pressure was off. She had a UTI, I believe, stuff like that. So she was in the hospital sick. They were trying to get her pressure right. She was on antibiotics and all of this. So look, I go visit my Aunt Hattie in the hospital, right? I go visit my Aunt Hattie in the hospital. And by that time she should have been getting better. So I sit there, I take a seat next to her, and I'm talking to her. Next thing I know, the nurse comes in, right? The nurse comes in, and it's time. And I guess it was lunchtime too. I saw the tray there, but my aunt hadn't eaten anything. So I'm like, Okay, so the nurse gives her the medicine, okay, and then after, my aunt, she said, now open your mouth, because she had to, and she took the water. Anyway, so the nurse had to see that she swallowed her medicine, right? Okay, so I'm sitting there, I'm at a 90-degree angle, you know, I'm sitting at the side of the bed, but the nurse has a, you know, head on, you understand. Okay, so now I'm sort of peeping around, you know, and looking, and she opened her mouth. She had to open her mouth, move her tongue to make sure that she had swallowed the medicine. Now, when that happened, I said, and I'm looking at the nurse, and I'm saying, wait a minute, don't you see? You don't see? And then, you know, I'm not sure, because I'm like, wait, this is a nurse. If I seen, I know she should have seen it, okay? But obviously she didn't, because she went on about her business, okay? So I'm sitting there, you know, I had to take some deep breaths. I had to calm down, and I'm like, whew, what? So, just so before I jumped up, okay, I was like, okay, Aunt Hattie, just try and eat a little bit. And so she had some applesauce, so I went to feed her some applesauce, and she opened her mouth. Okay, now when she opened her mouth, then I had I had this kind of vision. Okay, so when she went to open her mouth, I said, I saw. I'm not going to tell you what I saw yet, but I saw. I'm like, oh, whoa. So what did I do? I ran to the nurse's station, and I'm like, nurse, can you please ask the doctor to please, my aunt, she need to see, we need the doctor right now. you know, that stuff was coming out of me. Okay, so she was like, why? I was like, well, can you just call? But I went ahead and told her. Okay, so finally the doctor comes and looks in I tell the doctor what I think my aunt has. Okay, and so she looks in her mouth, and then she says, yes, she has thrush. She has thrush. And so she, ordered the medicine, the wash, rinse, or whatever that they do for my aunt, because she had thrush. Okay? Now, see, the thing is, okay, as this relates to the low standard of health care for Black women, okay, because that's what I'm gonna call it. See, the thing is, the doctor had been there earlier. Okay, the doctor had been there that morning. Okay, I was there that afternoon. The nurse, I see the nurse look in my aunt's mouth. Now, I'm not a nurse. Okay, I am not a nurse. But I do have a little bit of knowledge, you know what I'm saying? So I was taken back by that. What if I didn't have the knowledge that I had? You understand? What if I didn't have that knowledge, okay, to know that my aunt's tongue being white, had that white coating? What if I didn't have the knowledge to know that that was thrush? Guess what? They would have sent her home because she was having trouble eating. They were saying, oh, she didn't really want to eat. Okay. And so then, okay, she would have gotten better. The test would have shown that she's infection free. They would have got her blood pressure right. She still would have went home, wouldn't have been able to eat. And then she would have died of dehydration and all of that stuff. Okay, starvation or whatever. And then everything would have shut down because she wasn't getting the nourishment and stuff she needed. Okay, so look at that. Another incident. My aunt, her sister, my grandmother's other sister, was in the hospital. And I'm not going to name the hospital, okay? I'm not going to name the hospital. So I get a message, from one of my cousins and everything, and from my aunt, who's a couple of states away, who couldn't be here. The hospital wanted to call her family together, her sisters, call them together because they wanted to stop treatment. She was in the hospital. She had sepsis. They wanted to stop treatment. Okay. And basically they wanted the family to come together so that basically the family could give them permission and say, oh, okay. It's not working. Yeah, we understand. Just, yeah, go ahead and stop. Okay. And the thing is, she had sepsis. She was in a nursing home. And a lot of times sepsis is usually a result of a urinary tract infection that has not been treated and has the infection has spread into the blood. Okay, so see, then that made me question, well, you know, what, do they ever check her? You know, some things, you know, look, I'm not the doctor. They're supposed, but then after I'm like, wait a minute, they didn't check that, you know, they didn't know she had a urinary tract. When was the last time they checked her urine? You know, just because she's in a nursing home, gave her a physical or, you know, stuff like that. Or you know, there should have been some type of symptoms for that. Okay, the area, you know, something should have showed. Okay, so anyway, my aunt, her other sister, she calls and she says, please go tell them to just do everything they can do to help my sister. So I'm like, okay, Aunt Lucille, I will. Okay, so I went up to the hospital. All right, I went up to the hospital, and I asked to speak to the doctor. Okay, and the doctor's telling me what my cousin and my aunt had already told you. You know, she's not responding to the treatment, and you know, we want to get the family together. You know, so that you know we can stop the treatment. And I was like, what? Who? What? You understand? I'm like, look, excuse me, doctor, okay? Excuse me, but what you're supposed to be telling me is that you are doing everything that you possibly can to help my aunt. That's what you're supposed to be telling me. I said, this, we don't live in an assisted suicide state. Okay, it's a crime in this state. Okay, so so I was taken back by this to hear the doctor say it himself. Okay, and so then, okay, and I said, look, if you don't do everything that you possibly can for my aunt, I said, I will sue you. I will sue you. I will sue this whole hospital. I will sue everybody. Okay, so then he goes on out, whatever, and a little later the nurse practitioner comes in and she wants to slap me around, telling me telling me the same thing, and then what she told me, she said, look, she said, you're just a niece. And I said, look, my aunt, her sister, called me and asked me to come here and represent for her. Okay? My aunt her sister called me and told me to come up here and represent for her, to speak for her. And she wanted me to tell you that she wants you and this hospital and these doctors to do everything that you can do for her. Okay? That's what I had to do. Okay, so then I call. Okay, so then, just so she knows, and without telling my aunt, I called my aunt on the phone while I'm there sitting talking to this woman, nurse practitioner. And see, I even told her, I said, look, I don't even know why I'm talking to you as a nurse practitioner, because you have no weight, actually. Okay, and remember that if there's a doctor around, don't talk to the nurse practitioner. Okay, but I told her I'm just doing it. I'm just being, I'm just letting you say your piece. That's all. That's the only reason I'm sitting here listening to you tell me this mess. Okay, so anyway, so I called my aunt. I put her on the phone with the nurse practitioner, and guess what? She said, oh, please do everything you can for my sister, da-da-da-da-da-da-da. Okay, so When she did that, that canceled out any plans of not doing everything that you could do. It canceled out not doing the stopping any treatment. Okay, so then the nurse practitioner says, well, there is one treatment, but she would have to go to ICU. So I'm like, okay. Okay. Yeah, okay. What now? You see what I'm saying? Okay, so they were going to call the family, okay, bumpkins, you know, the bumpkin family, okay, that don't know nothing, okay, and tell them, oh, there's nothing more we can do. Then she probably would have died. They would have stopped giving her whatever the treatment, the antibiotics and all of that, whatever medicine, that would have been the end of it. And she probably would have died, okay? So they went ahead and put her up in ICU. And I went there like, you know, late afternoon, okay? So when it came that morning where you could go to the ICU and visit, I went up there. The head nurse said, the head nurse said, I'm sending her back down to her room. She's fine. She doesn't need to be here. She doesn't need to be here. So, you see what I'm saying? So based on just those two experiences, I could probably tell you some more, okay? But, you know, because of this video mess, okay? But, so the thing is, here are two Black women that did not receive the best medical care that they could get, okay? But nobody knows these stories. You understand what I'm saying? Nobody knows these stories, but I'm telling you now. So, you know, so something, you know, we have to look out for that. We have to watch that. Okay? Now, in my next video, I'm also going to tell you another thing as it relates to cancer when it comes to Black women and the receiving medical care, medical treatment. Okay?